Hello, everyone, and welcome to our Feed Your Brain series. Today, we will explore dismantling the barriers to positive mental health in youth. My name is Paige Blaine, and I'm the event specialist here at Workplace Safety North. We appreciate your attendance here today and want to share with you that today is our second Feed Your Brain webinar in 2021. We have a great lineup ahead, including the Mother of Safety, Maureen Shaw, this fall. Before we get started, we want to mention a few housekeeping items. During the webinar, you may see the screen freeze up or hear static on the microphone. This is usually temporary and due to internet connection issues. We appreciate your understanding and patience with the technology. Your microphones have been muted, and we ask that you use the Q&A at the bottom of your screen for speaker questions. If you have any technical issues using the Zoom application, do let us know in the chat box and we'll do our best to help you. So to clarify, please put any commentary or technical questions in the chat box and speaker questions in the Q&A. Resource information and a recording of the webinar will be sent to you within 1 business day. Now I'd like to pass things over to host Angele Poitras, Community Engagement Specialist and Certified Psychological Health and Safety Advisor at Workplace Safety North. Welcome, Angele.
Thank you so much, Paige, and welcome everyone, depending on where you're calling from. Good morning or good afternoon. If you've joined us before, you know what we like to do first. We like to do a poll question. We like to see who we're talking with and get a kind of an understanding of where you are. So Paige, could we put up the poll questions? Thank you. So while you're answering the poll questions, I'd like to tell you a little bit about Workplace Safety North. We're one of the 4 based health and safety associations of Ontario, and we primarily serve the mining and forest products industries. We're a partner in the health and safety system of Ontario with our headquarters in North Bay. Our vision is every worker home safe and healthy, and we firmly believe that that extends to neck up, a mental health safety. Watch for exciting developments in new programs coming this fall. We are very true to our natural resource roots, the mining, the pulp and paper, and forestry, but we're always willing to extend a health and safety hand to our northern neighbors. Our health and safety specialists provide training, consulting, events management across the province, all to assist you in making your workplaces the very safest they can be. So Paige, do we have any poll results? So 38% of you are joining us today as a parent or caregiver, and 31% are employers. So pretty close mix in our group today. Employee age 25 and up, 46% welcome, and other. And 27% of you said they're worried about the mental health of a young person in their lives. As Paige has shared with you, please put your questions in the Q&A because our guests today are more than happy to answer your questions. So what I'd like to do is introduce the 3 guests that you'll be introduced to today. Our first guest is Amelia Spina, a friend of Workplace Safety North, and she is going to share with us a recorded message before we begin our conversation. Please note the opinions expressed belong to Amelia. It is her very personal story. Amelia recently completed an undergraduate degree at Nipissing University, majoring in criminology with a minor in psychology. Passionate about the topics of people and society, Amelia plans to return to academia to complete her master's in sociology. This fall, she's taking a year off of school and will be volunteering in Ottawa. With her drive for openness and her conviction to spread information, Amelia is going to share a brief history of her mental health journey and the lessons that she has learned along the way. Our second guest who will be joining us live is Eric Windeler. Eric started Jack.org with his wife, Sandra Harrington, and their closest friends in May 2010, after losing their son, Jack, to suicide. Since then, Eric has put aside his business interests and leads Jack.org full-time. Eric works tirelessly to inspire discussion about mental health, especially among young people. In 2013, Eric received the Champion of Mental Health Award from CAM, IHA, and the QE Diamond Jubilee Medal. In 2015, Eric was once again honored by Queen's University, receiving an honorary degree. Most recently, Eric was selected as one of the 150 CMHA different makers for mental health in Canada. Eric is also a recipient of the 2018 Queen's Alumni Humanitarian of the Year Award and the 2020 Ontario Psychiatric Association's Mental Health Advocate of the Year Award. Eric sits on the board of FRAME, a youth mental health best practices charity. And certainly last but not least, who will be joining us in person is Jessica Landry. She's a young leader who volunteers as part of Jack.org's youth network in Northern Ontario. She's from Thunder Bay, Ontario, and is a Francophone student at Lakehead University. Jessica Landry has a passion for aiding others, which can be seen through her work in the mental health realm. From starting a Jack chapter to becoming a Jack Talks presenter, to hosting a virtual mental health summit, she continues to make strides consistently. She's always eager to lend a hand to take part in new experiences, such as creating a Do Something initiative, doing a campus mental health assessment, and delivering community Jack Talks, especially ones focusing on bringing more Indigenous voices to the table. Additionally, she co-runs her campus's mental health peer support group, which focuses on equipping youth with cognitive behavioral therapy and dialectical behavior therapy skills, as well as volunteering for Kids Help Phone. Her latest projects consist of working on the awareness improvement of the mental health services available on her university campus, as well as creating a community mental health hub. So you see, 3 wonderful participants who are all making time to join us today. So welcome, Amelia, Jessica, and Eric. Thank you for making the time to join us today. Now I would ask Paige to play Amelia's recorded message for us.
Hello, my name is Amelia, and if you haven't read my bio, I am a recent graduate of Nipissing University, where I studied criminology and minored in psychology. During my time at Nipissing, I discovered how passionate I'm about attempting to understand people. This is ranging from the specifics of psychology to the broad context of sociology, so the good, the bad, and everything in between. Today, I'm here to tell you a story. 2 years ago, I was diagnosed with ADHD. And for those of you who don't know, that means I suffered through severe mental health issues for a large majority of my life. I grew up being told I was smart and mature, but my life never resembled that. I was a C student at best, and every aspect of my life was constantly a mess. I couldn't understand why I wasn't functioning like those around me, why my life wasn't representing the labels I had always been given. Obviously, this led to intense self-esteem issues and a whole lot of other stuff. See, a symptom of ADHD is emotional dysregulation. Basically, I have a really hard time understanding and managing my emotions. So any and every hardship that I faced was much more difficult than it had to be. And up until 2 years ago, I had no idea why. This past March was the 10-year anniversary of my mom's death. I was 11 years old and no hit at my dad, but any form of support for my mental health died with her. At the time, my dad was 54, meaning he grew up in an era where mental health didn't really exist. He had little to no idea how to support me in regards to my mental health, and to be honest, he didn't even know he had to. On top of all this, he's Italian. I'm guessing, well hoping, most of you have heard of the stereotype of Italians being hard workers. Well, it's true, but it comes with a price. In my experience, that price is ignoring health, both physical and mental, to get the job done. This mindset was so ingrained in my Canadian Italian grandparents, my dad, and not surprisingly trickled down into me. So I can confidently say I've been depressed for a large majority of my life. But this mindset isn't limited to Italians. It's ingrained in all of us. Youth today are overwhelmed, and the fact that my generation has the highest levels of reported anxiety doesn't really come as a surprise. We live in a society that is obsessed with productivity, and I think everyone would agree it's exhausting. On top of all that, youth grew up overloaded with information. Because of technology, we know everything that's going on in the world, from major world events all across the globe to the life of each person that we're following. Now, since COVID's put everyone online, I think older generations can understand this more than ever. Over the course of this last year, I'm on, let's call it a mental health journey. I'm sitting down with myself and my past. I'm evaluating the trauma that I've been through while attempting to be aware of my current emotional state. Essentially, I'm putting myself first as much as possible. But the reality is, the only reason I can do this is because I'm painfully unemployed. I've been working since I was 15, and in that time I've learned it's incredibly easy to know the values of a company just by how they treat their employees. Speaking from experience, it makes a world of a difference to a young person by just feeling understood and supported. I can't even begin to imagine the impact it would have had on me if my dad's generation was educated on mental health. You're probably wondering why this random woman is telling you her deeply personal life story. To answer that question, I believe in the power of vulnerability. Some may say I'm naive, but I believe that any form of vulnerability can positively impact someone. Out of everyone watching, odds are at least one of you will take what I've said and use it to impact others. I'm a big believer that we are a mosaic of every person that we encounter. Thank you.
Thank you very much, Amelia. It was my pleasure to meet this young woman, and I want to congratulate her on her bravery for sharing her very personal story. So now we're going to proceed with the real conversation with Eric and Jessica. So if you've attended a Feed Your Brain before, you understand that we base it on 3 themes, and it's based on research, and it's based on questions and comments that you, our participants, will have shared with us. So the 3 themes today will be the impact of the pandemic on our youth, how parents and employers can engage youth in mental health strategies and conversations, and at the end, we're going to do this. We're going to ask Eric and Jessica to share with us their greatest learning. What message do they want to leave us with at the end of the day? Recently, I have a hard time with these numbers, and it always makes me stop in my tracks. But in late May, Children First Canada released the following statistics. They suggested to us that suicide attempts of our youth have increased 100%, and substance misuse has increased 200%. The top children hospitals all agree that there's a mental health emergency among our children and our youth. Jack.org states suicide is still the #1 health-related cause of death for our youth. As a mom of 5 and a grandmother of 6, this absolutely breaks my heart. But I also know that today's passionate youth mental health advocates and ambassadors will make this world a better place for our youth moving forward. So Eric, as our first speaker today, I'd like to have you explain what Jack.org is, and maybe give a glimpse to our participants today about what your why is, what it is that makes you tick. And welcome, Eric.
Thank you, Angel, and thank you, Paige, for the lovely introduction. And I'm just honored to be here with one of our amazing young leaders, Jessica, and just great to be here. So, it was explained in the intro how I got involved. Amelia's very thoughtful video actually resonated with me because I'm probably actually a little older than her father. And so, yes, I grew up in a time when mental health literally was not a conversation. And, if you were to ask me 11 years and 3 months ago, literally the day before we lost my son, Jack, to suicide, how we were doing as a family, I would have told you, oh, we were doing great. We were, happy, healthy, both employed, had good, I was an entrepreneur. My wife was an executive at a bank. We thought we had 3 happy, healthy children. And, it's a horrible way to get your welcome into the whole world of mental health and suicide when you lose a family member, let alone especially a young person in your family. And that is completely, that has become my North Star, I guess, Angel, if you could say. And I'm not quite sure why I had this specific calling, but the bottom line was, when we started looking into it, we felt that if this could happen to us, what we thought was a very happy, healthy family, this could really happen to anyone. So we started looking into it. And we've really dedicated our work to supporting young people. So Jack.org now has a staff of 60. We're a national charity. We have activities in every province and territory of Canada. And it's not so important what our staff do. What's so important is about 3,000 young leaders like Jessica, who work with what we call our peer-to-peer model of educating young people about mental health. And we know from the evidence that that's the most effective way. You know, young people don't want to listen to a 60-year-old nearly as much as they want to listen to a peer. And we found that out the hard way by doing a pilot study in the early days. And we made an impact with that pilot study, but we really learned that young people were being left out of this conversation. So that's a bit of a long answer, Angel. I don't know if it completely covers it, but that's our calling. I can tell you more about what Jack.org does if you'd like to hear that. But we work with young leaders to really revolutionize how that generation, this young people, learn about mental health long before they're in crisis, because you can really benefit, we can all benefit from understanding how to take care of our mental health and support those around us.
Well, Eric, I want to thank you for explaining to all of us about what your North Star is. And I've been to jack.org, and I strongly encourage everyone at the end of this conversation, not during, but at the end, to go there. Whether you're somebody who's looking for youth resources or not, highly amazing information that I found, and I'm starting to use it all the time. So thank you very much, Eric. Jessica, can you share what your role is at jack.org and maybe about why you joined?
So I'm sort of involved in a few different things, but one of them is the speaker program. And so what we do is we deliver talks that go towards mental health education, awareness, and also just destigmatizing combos around it. And then one of the reasons why I got into it was because I started a Jack.org chapter. Jack.org reached out to us because I did run a peer support program at school. And we thought we could branch out, we could do more advocacy work in the community, and it was a great way to partner with them and then be able to help us also shape the resources and our understanding of mental health as well.
So Jessica, what is it like when you do a presentation? And prior to COVID, I would imagine some of them were in person. What kind of feedback do you get from the people in the audience when you're doing a peer-to-peer kind of conversation?
One of the biggest things that I see in every talk is we like to share our personal stories and our mental health journey, and a lot of kids are able to resonate with that. And I think that really empowers them and also can be a bit of an inspiration for them, that if other individuals, right, who were in a situation like theirs can get through, struggling with their mental health, and they can do so as well.
So you're kind of a beacon of hope, and you're letting all of us know, even not just youth, but even adults, that we're not alone, right? And you're very brave. You're very much like Amelia to, share your personal story. So I want to thank you for that, because I believe what Eric said. Our youth are going to learn best peer-to-peer, right? Not like an old person like me having a conversation. Needs to be somebody in your age group. So each of you has had a different kind of viewpoint of the pandemic. Certainly, Jessica, you've had one as a young person living through the pandemic. And Eric, as the president of Jack.org, you've had another kind of viewpoint of the pandemic and youth. So I'd like to ask you each kind of share with our audience today, what's your viewpoint on youth in the pandemic, coming from your very personal space in which you live? And maybe we'll have Jessica answer first.
So I think one of the first things I've noticed is the impact of isolation. I'm a university student. I know many university students, and it's been very hard for them. Online courses and the transition from that has been difficult. One, because it seems like the workload has increased. Gone are exams, and it's more heavily weighted towards these assignments, which already we didn't have time for. And then on top of that, you also have to factor in that it's always online. It's constantly over Zoom calls, and it's just very tiring for students to always have to be online and on their screens, and then not be willing or wanting to go and interact with other students on, student activities going on, or even if it's a resiliency workshop that are student health and wellness friends. So they're isolating even more in a sense, because the only way you can interact is online, and we're so out from classes that we don't want to go and talk to our friends over Zoom. And then additionally, another thing that I've noticed is professors have also a big workload that has increased for them. And so they're not responding to emails. And so we're trying to reach out to classmates to get help, but a lot of us also don't know our classmates and we don't really get that chance to meet in class. So it's really weird to just reach out to someone random on a student list and hope that maybe you can get help that way. So a lot of that has been very difficult. And then additionally, I know a lot of community programs have shut down, which can be very hard, especially for low-income households and kids who usually go to those programs to seek a sense of community and purpose, and potentially don't have the opportunity at home to reach out over the internet. They might not have that to get that connection as well. So I think a lot of it is the isolation.
Yeah, that's what question I was going to ask you. I mean, university, it's certainly what we parents would like to think. Education is the #1 reason you're there. But the second reason, it is about socialization and doing new things. Like, do you feel like, I don't even know the right words, do you feel ripped off that you're not getting the whole experience maybe of university? Because some of the young people I've talked to say, yeah, I feel like I'm missing things that I'm never going to get back.
For sure, I think that's a big part of it. I think for me, at least, it's sort of my 4th year, so I have had a bit of experience at this point. But I think a lot of students, especially first years, right, they don't get to do the orientation. They don't get to meet new students. They're very alone in that sense, versus I have friends in my program already.
Okay. Well, that's good to know. I'm happy for you. So Eric, what about your window on the pandemic and youth?
Well, I like to put this in perspective, especially for this primarily adult audience. Change is hard no matter what the change is, okay? And obviously, for all of us, this is unprecedented change that has been happening in the last while. But it's hard to deal with a struggle when it's happening for your first time. So, I often tell the story of a board member who reached out to me probably about May of last year, and she really opened up. This is a woman about my age who, frankly, has never struggled. Very passionate about mental health, but never struggled, and opened up about how much the pandemic, even just a couple of months into it, was already making her struggle. But she had coping mechanisms, right? She lived in a full-size house. She had all kinds of ways that she could deal with it. And she, as I say, she's about my age, so she had ways of dealing with things. It's unprecedented on youth because often they haven't had this kind of disruption. And that also, there's an analogy to mental health struggle period, and why it's the most risky for young people in these transition years, because they haven't sort of built their toolkit. They haven't gone through a lot of the life's learnings that many of us have. And, when it's happening the first time, it can be the most dangerous. And with such a sort of a cloud of stigma that has been, hovering over most of all cultures with respect to mental health, that has prevented people from putting their hand up and, reaching out for support early on. But we're hearing from, our staff who are dealing directly frontline with our about 200 Jack chapters around the country, that young people are struggling. I'm seeing it with the young people in my life. And anecdotally, you mentioned the study of 100% increase in the rates of suicide attempts. I've actually haven't heard, that was news to me that it's at that level, but to what I had heard from my board chair who works at CAMH is that there hasn't been a dramatic increase in suicides, but they're completed suicides, but there has been a dramatic increase in struggle. And that makes total sense. Anecdotally though, I've been supporting more families that have lost young people in these last 12 months than ever before. So, if you can imagine it, to the first analogy I gave of that parent that I know who used to be on our board and how suddenly she was struggling, and then imagine hitting you the first time. And that's why it's so dangerous for young people, because it's hitting them the first time. And I think of my son, this was 11 years ago. We had never really talked about mental health. His friends hadn't talked about mental health. The residence down on his floor wasn't trained in mental health, and he was showing all kinds of signs of struggle, even in a normal, environment. But no one was there to help him, and he wasn't comfortable reaching out for help. And those are all things that are affecting young people, but accentuated during these unprecedented times.
Right. Thank you for that. And what we're starting to hear now is moving forward as we return to some kind of normalcy, and I'll use the word that is used quite a bit. What do you see as challenges moving forth for our youth? Because some people are suggesting that what we're seeing is just kind of the tip of the iceberg, and that they're anticipating moving forward. There's going to be a momentum. There's something that's building. Do either of you have an opinion on that?
I think one of the biggest challenges is going to be a lot of social anxiety and also readjusting. Readjusting just to classes in person, for example, is going to be huge. Seeing all these individuals, maybe kids starting out in high school or starting their university career or entering the workforce, and everything is suddenly a lot different than what they've been doing, is going to be very hard. And so I know that me and my friends, we did the Jack Ride walk this year, and it was already just anxiety seeing our friends even, and just not knowing exactly how to interact.
Yeah, difficult, isn't it? Because I struggle with it too. So, yeah. Thanks for sharing that with us. Eric, what about you from a jack.org perspective?
Well, for sure. People who struggle are going to struggle readapting to another change, and there will be this change. Many people are calling mental health sort of the second wave of the pandemic. And while in Canada, relatively speaking, we're very fortunate with our vaccination rates and all the rest of it, there's so many things that impact youth. I cannot overstate how, and it was alluded to in Amelia's video, how kind of switched on young people are to world events. And, the social media feeds are just filled with all the things going on in Canada with the tragedy in Kamloops, and now across the country, things happening, in the Middle East, all around the world. That combined with all the other things, and then now, by the way, you got to go back to class, and adapting to that. So especially for those who struggle, it's going to be challenging. I think it will be in some ways a good challenge to get back to normal, and hopefully workplaces and schools can be understanding of young people who need to transition back at a certain pace, as opposed to just be thrown from one world into another world immediately. We're certainly, for example, with our staff, we're polling them on what they're going to be comfortable with in terms of coming back to work, on what basis, how much, and that sort of, I think, consideration should be in workplaces, and certainly at schools.
You talked about something brilliant there about the bombardment of social media and everything that's happening on top of the pandemic. I remember years ago, my youngest daughter told me, "You don't understand what it's like. We have a 9/11 happening every moment on here. Lloyd Robertson doesn't have to shut down all TV and come on screen and tell you what's going on." She says, "We have it constantly." And I never quite understood it until she put it in those terms. And I thought, no wonder there's anxiety and stress, because I can remember how I felt 9/11. And, she suggested to me that it's part of their everyday world right now. And that's something that, me, my age, I didn't understand that until I listened to her words. So we're going to kind of go into how can we help employers and parents engage our youth in mental health conversations and some wellness strategies. So Eric, Jessica, I'm going to start with you because you're a mental health advocate. So how do we as parents and employers start conversations with the youth in our life, and how do we ask them, "Are you okay?" How do we ask them in a way where we can get them to maybe answer us honestly so we can help them?
I think one of the most important things is to keep it private and be patient with them as well. Sometimes you might broach them and they might not feel comfortable at that moment. They might need you to approach them a few times before they're able to feel comfortable sharing. And so we've got to respect that. But I think one of the easiest ways to try to get them to open up is to do something that you would normally do with them, or something that they love to do with them. And, not during the activity per se, but maybe later after, so they don't feel super cornered about it. You can bring up the topic. And I wouldn't suggest asking close-ended questions or questions just like, how are you? Because I think we all know they're probably going to say, I'm fine, I'm good. I'd say ask how classes are going, or how do you feel like COVID is, or even bring up how you feel first. And so they can maybe feel comfortable sharing and responding to you as well. And again, I think just those positive experiences and doing something with them in general is definitely going to help, whether that's a self-care activity or it's just something fun. Being able to distract you sometimes from everything going on, or just give them those positive experiences and making them feel cared for is very important as well. So I think that's a big way to do so. And then also, and I think we'll talk about this later with Be There, but connecting them to help and putting that first step with them. So whether that's like contacting a line with them or driving them to a counseling center, something that will just show that you care, but also connect them if they need to. If they don't feel comfortable with you, that's okay, as long as you connect them to someone who they do want to talk to.
Those are words of wisdom. Thank you very much for those. I wanted to be jotting them down as you were speaking, but I didn't think that was professional. So I think I've got them here. So thank you. Eric, as a parent yourself, how do we as adults strive to understand their world and how it's impacting their mental health? And is there any kind of wellness strategy that you've seen that perhaps as adults we can help introduce in a very good way, as Jessica has just explained to us, to the youth in our life?
Well, Jessica had some very good points, and I'll just elaborate a little bit there. To start with, and I think back to my story and to the story of Amelia's father that she explained in her video, you need to educate yourself as the parent. That is absolutely critical. I think of what I know now, but compared to what I knew 11 years ago, and it's just completely different. You also need to be listening and watching for warning signs. So that's part of the education, is understanding if you are seeing there are lots of signs and symptoms of mental health struggle, but the basic one is sort of a distinct change in behavior that lasts for a prolonged period. So anybody can have a bad morning or a bad day or two. Something could be stressing. A young person could be stressed out because there's an exam coming up, or they just lost a big hockey game, or whatever it might be. But if it's prolonged, and we typically say if it's going on for, let's say, 2 weeks, and you're noticing that distinct change in behavior, that is the real warning sign. And as Jessica indicated, you really need to pick your time to find out how to broach those things. And we'll talk about it in a little more detail going forward. But also, I think, especially as parents, we need to be really authentic about our own story. We all have had this temptation passed down through the generations to make it seem like, we were tough and resilient and we never struggled at all. And that's simply not true. But, I could say that for most of my early parenthood, I followed that pattern. It's what I had been taught. And I didn't share the tough parts of my upbringing. I shared just the good news. So how does that make a young person feel when they're not quite keeping up? We often talk about for our son Jack, Sandra and I never put heavy expectations on him. We always said, if you want to be a Starbucks barista or a teacher or a doctor, and I quote, that's exactly what we said. That's all fine as long as you're happy and you're working hard. That was kind of our message. But that doesn't mean that was his own internal expectations. As he saw parents who were doing well, both in their career, in their life, and had done well at school, all those sorts of things, those internal expectations can be really heavy. So as Jessica said, I think it's really important to model that healthy behavior about, you have some struggles. And there is a little term that resonated. I learned it from a parent several years ago at a parent talk we did. And I'm sure that parent didn't invent it, but it's called the rose and thorn. And, that means at dinner time or sometime, just when the family is together, talk about the things in your day that went really well, the rose, and also talk about the things that were difficult. And that gets a behavior of young people, opening up about what they are struggling with. Instead of just saying, yeah, work was no problem, I kicked ass, be honest about, hey, I had a really tough meeting with my boss or whatever it might be. And that helps model that behavior. And we'll talk a little bit more going forward about how you find that right time and how you weigh into those conversations.
It's interesting, isn't it, Eric? Because we're in the same age group, and as a young child, my mother struggled with mental health issues. And when she went away to the hospital the first time, we were told that her bunions were being removed. And it was only as a young teenager I realized my mother still had bunions, and that's when I started asking some questions. And as parents, we try to protect our children, right? And I think that the nugget of learning for me is listening to you share the rose and the thorn. Don't hide it from them, because we're not doing them a service, we're doing them a disservice, right? Because I've lived it, and it's I'm really glad that you brought that up. That's certainly a really good nugget to fit in with Jessica's learning. So I'm going to ask you to each tell me a little bit about signs and symptoms. And I know this is something that people are really interested in. And I know even in our conversations on our end, we have a lot of it. So Jessica, I'd like to ask you, when you're an ambassador for JAT.org and you're having these conversations, what are you looking for as potential warning signs in the youth that you might be having a conversation with?
So I'd be looking for abnormal behavior for them. So, the way that they react to stress, if it's more heightened, then that could be a sign that maybe they're struggling right now, and that the stress just keeps elevating and elevating, and they don't know how to let go of it or fix that situation that they're in. Another thing would be if they're potentially doing things that will have a huge impact on their life. So if they're missing classes, that's a big sign. If they're not going to the things that they love, like rehearsals or practices, things like that, if they're not hanging out with their friends, those can definitely be big warning signs. Another thing would just be isolation. If they're isolating themselves, that's usually a huge sign, whether that's not talking to you or their friends, or playing video games at all hours of the night, whatever it is that could be strange for them and abnormal, that can definitely be a huge sign.
Okay, thank you for that. Those are very valid points to keep in mind as an employer and as a parent, if we could be witnessing this in youth. And Eric, as a parent yourself, and as somebody who's immersed in this, as parents and employers who are joining you today for the conversation, what can you share with us that we should be looking for in the realm of being a parent or an employer?
Well, I think we've covered a lot of it. The broad answer is any sort of distinct change in behavior. And that's why, back to our peer-to-peer model, and if you think about it, that can apply to family situations. You know the young people around you in your workplace. You may not know the normal behavior of someone who is 50 offices down the corridor, but the people that you interact with each day, you will generally get to know their behavior. And keeping an eye out for that type of sort of prolonged change in behavior is key. I would like to, though, underscore to your audience, for adult audiences, and it can be for emerging adults as well, young people. The whole idea of substance abuse is something to keep an eye on. And back to that study that you referred to earlier, addictions has become a big issue, for people to sort of self-medicate, but then it goes a little bit too far, and that can be something to worry about. But I'd also, and I've been dealing with something like this in my supporting somebody just recently, and I think this is really relevant for parents. And this family had decided they were going to to send their child, who was going from middle school to high school, to a different school than what he was expecting. And they immediately noticed some different behavior. He wasn't happy about it. And he actually made a comment, if you send me to that school, I might jump off a building. So I don't mean to be triggering to anybody, but that's how upsetting it was to that young person. And thankfully, that mother took it seriously and actually reached out to me, and I'm sure others, to get them some sort of support. But if what I'm trying to use as a specific example is if anybody talks about self-harm or any kind of just helplessness, or I don't need to be here, or those kind of comments, those need to be taken very seriously. Not just, oh, that person will get over it type of thing. And that's a time to really to wade into that difficult conversation.
Thank you, Eric. And that's exactly what I was hoping you were going to share with our group, because oftentimes we can be dismissive. And so thank you for reminding us not to be. And I see Paige has joined us, so that would mean she's got a question from the audience. Hi, Paige.
Hi, thanks, Angel. So we do have one question from the audience, and it says, what age range do young people consider to be their peers?
That's interesting. Jessica's truly the young person, so she has the lived expertise on this, but I would say it's within sort of a year younger and a year older sort of thing. You know, and I know when I was in first year university, I thought of not even second years weren't my peers. They were a whole different, you know, class, so to speak. And certainly the fourth year residents down on my floor, that was someone who was so much more experienced. So I think it's generally people pretty much your same age, unless your social group, you know, maybe you're part of a theater group or something. So it's the whole high school, grade 9, 10, 11, and 12 working on a play or a musical or something. Then it might be a bit broader, but Jessica, do you agree with that? Or?
No, I definitely agree, but I would also throw in sometimes peers are also just youth, right, who have some lived experience very similar to us, right? And sometimes that's how we connect with those individuals more. So I could have a friend and she's 19, but if we have very similar lived experiences, then that's definitely someone that I would consider a peer that I can connect with, and a lot more than someone even my age who has never had those experiences before.
Thank you. That's interesting. Is there another question, Paige? No, I believe there isn't.
That was the only one.
That was the only one. Brilliantly answered. Thank you, both of you. When we talk about having mental health conversations, those of us who have to initiate the conversation are often very afraid to do so. We're afraid to make it worse. We're afraid we won't know what to say. We're afraid of a multitude of things. So I'm going to ask you each, if you could provide some wisdom to us that might be afraid to open the door, what do you say to us?
I think the biggest thing is it's probably nerve-wracking for anyone. And I think some of us are always going to be unsure of what to say. I've done a few different trainings in this, like suicide prevention, and it's still a bit of a confrontational moment, and not wanting to pressure someone or making them feel like I don't believe what they say. I want to validate them for sure. And so I think the most important thing is to just speak. It's better to speak than not to speak, and even just showing that you care and just bringing up the topic with them, it might mean a lot to them. I know a lot of individuals, sometimes they just seek out to be heard even. And so whatever you can offer, you know, it's best to do that than not to. And like I said, if you want to do so while you're doing an activity or something that you're familiar with, then that can definitely be a way to do so, because then it might come out a bit more natural and flowy.
Right. Thanks for that. Eric?
Yeah, well, I'm going to dive in a little bit. We actually learned about this about 4 or 5 years ago, as more and more of our JACC chapters were getting going across the country. We actually heard from our young people, our young leaders like Jessica, that more and more of their peers were kind of opening up, and they wanted to learn how to support them. And I want to underline, we weren't trying to train them how to be a mental health professional. You know, these are often people, so, you know, our age demographic is 15 to 24. So they're young people that, you know, some of them will go on into that type of professional career. But we wanted to give them some basics about how to literally be there for their peers. And as is our approach, we didn't just jump in and create something. We did a lot of research. We did a landscape scan, and we, not just in Canada, but around the world. And we were looking for something that was both evidence-based and was engaging to young people. Because frankly, and Angel, you'll probably know this term, Jessica will know it very well. If it's not engaging to young people, they just scroll on by, literally. Our donors came to our support when we suggested this project, and we actually raised about $600,000. So it was a very thoughtful approach we took to building a digital resource that's called Be There. So jack.org only has two websites. One is called jack.org, obviously. The other is called bethere.org. And you know, you can't talk about supporting anybody without using the words "be there." So that's why we named it that and got that URL, that domain name. And just very briefly, it's based on evidence that we learned, and it's a series of short videos that show one person being there for another person. So they share the story, and they very empathetically show about, you know, how that person really helped them through it. And Jessica touched on it, but it's based around what we call 5 golden rules. And the first golden rule, and all of this should be sort of a précis, that you don't rush into it. And I remember one parent saying to me, you know, I used to, when I was worried about my son, I used to sort of pin him against the headboard and sort of drill him with these questions. You want to do the opposite of that. You want to find a time, maybe you're on a walk. Often people think a car is a great place to do it if you're on a drive, because you don't have to even have direct eye contact, and you can find a gentle way to weigh into that conversation. But the 5 golden rules, they're all on the website, so you can learn a lot about it. But the first one is say what you see. So this is an authentic way to just simply describe the changes you've noticed in that person, and tell them that you're a bit worried about them, and you want to be there to support them. And you need to make sure there is no judgment implied. Like, I've noticed, this would be the exact wrong thing to say. I've noticed you haven't been going to soccer practice. Come on, toughen up, get out there, you know, and get out there with the team. You don't want to approach it that way. You want to approach it that, you know, I know soccer has been very important to you, and you're always the first one there. And it's a little worrying to me that you haven't been out at practice for the last couple of weeks. More of that type of approach. So that's the first golden rule, say what you see. The second, and Jessica touched on this, is show you care. So being empathetic and creating a safe environment that you know, and that might mean that you put a hand on their shoulder in normal times, or you actually give them a hug, or you just tell them how important they are to you. And that means so much for someone to hear that person cares for them. And then you need to give them space. You need to open it up and hear them out without judgment, and being a good listener. And we always try to emphasize, you're not trying to fix them. You're trying to hear them out and understand how you might be able to help them and help them help themselves. All the while that we're doing this, we also have to protect our own mental health. So the 4th golden rule is what we call know your role. So again, you're not there to fix them. You're not there to be their doctor or psychiatrist. You're there to be their peer, their parent, their sibling, trying to support them, and keeping some boundaries in place so you're not damaging your own mental health by doing it. And I often refer to, you know, sometimes you need to call in Uncle Mike. I have a brother named Mike, so I use that analogy. But you may not be the person to weigh into that conversation, but your role could be to find your Uncle Mike, who is a real trusted adult to that young person, And that might be reaching out to one of your, maybe it's your son or daughter, you're concerned about reaching out to one of their close friends and having them sort of navigate that situation. And finally, if you are worried, that's when you need to be educated about what resources that are there. And that comes up, the fifth golden rule is connect them to help. And that's where you can, literally, we've had young people who literally dial up kids' help phone and hand the phone to the young person so they're comfortable doing it. Because if you're really struggling, you're not in a great place to find the resources, and you may not have the kind of the gumption or ability to reach out. So helping them get that help is critical.
Eric, on behalf of every parent and every employer out there, I want to say thank you to you and your donors for the 5 golden rules. I think they can be applicable to almost anybody in our lives. So thank you very much for that. And I see we have Paige has joined us. Oh, Eric, one last thing, and then we'll go to Paige.
I don't want to sort of brag on us, but
please do.
We're so proud about Be There. It was actually nominated for a global Webby Award. So this is website awards globally, and it actually won the People's Choice Award and the Jury Selection Award as the top health website globally. So you're not looking at just a basic website. And by the way, we've got a lot more coming on Be There, and a Be There training certificate, we're calling it, so people can actually formally get trained on Be There through the resource. But it's a free resource, anybody can check it out. And if you're worried about somebody, this will help you understand how you can weigh into those tough conversations.
Well, thank you, and bravo. I don't know if you can hear me, but I'm clapping for you, and I'm sure the audience is too. And unfortunately, in a virtual world, you don't get the accolades that you both deserve, Jessica and Eric. Hi, Paige.
Hi, Angel. So the question is, if you could recommend the best free support program available for youth, what would it be?
You said the best free support program?
Yes.
Do you want me to give that a shot, Jessica?
I can also weigh in if you'd like, and then you can add something if you want. But I think what I've heard is Kids Help Phone is a huge one, especially because they have the texting or chat option, and that's more comfortable for some individuals than just calling. And it's something that you can stop anytime, so you don't feel that pressure to continue talking if you don't want to. But I think another one that has really come up, and especially for university students because of the age range, it goes higher, is Wellness Together Canada, which is quite new. And so they also have a few other services available, but they do have the crisis line, and they do have workshops that you can do and learn skills on your own. So I would definitely suggest those. And both are also bilingual, so those are great.
And we'll make sure we include those both in our resources. Thanks, Jessica. Eric? Jessica has a third.
No, I was just going to throw in something because I thought this was really cool, but Wellness Together Canada also has a crisis line specifically for frontline workers. So if something regarding that or stress in that environment, then that's definitely great for those as well.
Oh, that's brilliant. Thank you.
No, I think those are both great suggestions. There are all kinds of supports out there, even though, I have to say, we don't really have a proper mental health system in Canada yet. There are great resources out there. Kids Help Phone for young people is such an accessible, free, multi-dimensional way that you can reach out for support. And on the other end of the line, there are both professional supporters, but there's also, as Jessica mentioned, peer supporters who are trained. Many of the young leaders in Jack.org also do the crisis support through texting, because that can be a sort of an easy way into those conversations. Wellness Together Canada is brand new. It's been up only since COVID, but there's lots of great free resources there as well. And then in each community, things are getting gradually better. The way I'd like to put it is, all communities are now on the trajectory. Many of them are at the very start of that trajectory, but hopefully post-pandemic, we can keep this momentum going, and it's going to take us all to keep that voice loud to do so.
Well, Jessica and Eric, much to my dismay, we're near the end of our conversation already. There's just never enough time. So I just want to share with the audience that we'll be sending you the recording and the resources after, and we'll make special note of the information that Jessica and Erica have shared with us today. And I want to share with you some good news. Recently, the government has announced that they're going to be investing $20 million in youth and children's mental health. And I want to ask yourself, what can I do for the youth in my community and in my workplace? And I want you to remember Amelia's words. We are a mosaic of every person we meet. And there was a reason that each of us met today. So as with tradition with the Feed Your Brain, we end it with our guests sharing us words of wisdom or one powerful word or comment or story that they want to share with our group. So I want to thank you both, Jessica and Eric, for joining us, Amelia for your bravery and giving us your recording. And I hand the stage to each of you to provide you your opportunity to share something with us. Who would like to go first, Jessica or Eric?
Go ahead, Jessica.
Okay. I think just the most important thing is to reach out to youth if you think that they're struggling. Sometimes it's better to reach out, even if we don't know if they're struggling or not, than not do anything about it. And a lot of times youth won't feel comfortable taking the first step. So it's important to take the first step for them.
Thank you, Jessica. I'm sure there'll be lots of steps taken after this conversation. Thank you. Eric?
Yeah, it's so true what Jessica says. You know, I think back to 11 years and 3 months ago, I had no clue. And I'm not trying to judge your audience, but if they haven't been impacted by mental health, there may be some people that are in that sort of situation themselves. So this issue is so important. You know, we alluded off the top that not only in Canada, but in many developed countries, suicide remains the leading health-related cause of death. And that is just completely unacceptable. And it's still a very infrequent thing that happens, but it's kind of a marker for the amount of struggle that's going on out there. And there's another study that I often refer to that was done a couple of years ago, but 53% of young people in this Canada-wide study had their first interaction with the mental health system at an emergency room when they are in crisis, okay, and potentially suicidal. So if you think about that, that's completely unacceptable. And that's why we're so focused on this upstream education piece to get this conversation going. And, you know, you really can do so much good. It's like ideally preventing somebody, I don't mean to be judgy here, but if you can educate somebody about the harm of smoking, for example, that's a lot better for them, but also better for the overall system, because it's much more costly to take care of somebody, you know, when they're in stage 4 cancer, obviously, as tragic as that is as well. That analogy applies so much to mental health, and that is educating ourselves, taking a lead as parents on how to educate and help their young people to get involved. They're not all going to step up and be an amazing young advocate like Jessica, and that's totally fine. But they can get educated about it, so they're ready to be there for themselves, be there for their peers. And I often think that's a great way into that conversation. You know, are you worried about your son or daughter's peer group, someone in their peer group? You may have noticed that, and that can be a kind of a gentle way in to have that conversation. But if we can have that done, these conversations with young people, they will build their own toolkit, as I call it, and they'll have lifelong benefits. And you know, they'll be able to deal with struggle as it happens in their life, as it's naturally going to happen in their life. We're all going to, you know, go through periods of tough times. And if we get that resilience built in those early days, it can be critical. But let's all together keep conversing about this in all of our regions around the country, because there is no official system. We've got to build it. We've got to get it funded, and we've got to make it much more accessible to everybody. And not just an accessible resource, but a contextualized resource, you know, for newcomer Canadians, for Indigenous Canadians, for BIPOC youth. We need to have accessible resources, so it's not just those who are educated and have a benefits plan to pay for the mental health services. everybody should have access to it. You know, we all can go get our broken leg fixed at any clinic or hospital, and it doesn't cost us anything. Why is it not the same for mental health, which is much more damaging potentially than a broken leg?
And on that brilliant thought, this is where we're going to end our conversation. I want to thank you both for your bravery. Eric, especially you for starting jack.org. It has been an eye-opener learning about your organization, and I encourage each and every participant today, go out and do something in your community or your workplace to support youth and mental health. Thank you, each and every one of you. Enjoy your day. Goodbye.
Thank you.